Good day, my wonderful audience. Welcome to yet again another episode of our online fertility awareness program, You and Your Fertility. This is our 20 Steps to Pregnancy series. This is episode 18. Just 2 more steps to go and we'll be done with this series. It has been quite exciting. We've learned quite a lot in this series. What you can do as an individual to help your body stay in the state of being able to get pregnant. Episode 18 today we'll be talking about weight management. Yes, it's something that many women don't want to talk about. They don't like to hear this part, but we are going to talk about it because it is all too important and can actually contribute to the fertility status of a person. So weight management, what has weight got to do with pregnancy or being able to get pregnant? Does it mean that if you're on the big side you can't have children? Does it mean that if you're on the small side you can't have children? What exactly does weight management have to do with the ability to fall pregnant? Now, what we need to know is that our body's weight is something that our body grows into. Okay, so if maybe right from time you have always been on the big side, your body, that is what you are used to, that is what you have always been, on the big side. If you are also somebody that is on the small side, maybe that's what you have always been, on the small side. Now what we are focusing on is a change in your weight status. Okay, so maybe you are just somebody that is on the average and then suddenly you just go boom and you just blow up. That is a significant increase in weight. Also, if you're somebody that maybe is on the average or a little bit chubby and then suddenly you just crash your weight, that is also a significant loss of weight, and that becomes significant, especially in this topic that we are raising today. Now, when there is a drastic change in a person's weight, what happens? We need to first of all understand that our body's fat is something that comes about following our body's metabolism. Okay, so once there is this drastic increase or decrease in weight, the metabolism of the body also is altered. There are changes in it as well. For people who are on the big side, you need to understand that the adipose tissues, which is the fat cells that you have extra of, also produces certain hormones, and the one that concerns fertility is the estrogen hormone. So if you are on the big side, you have your fat cells producing estrogen in the body. That is baseline information. Now, for the people who are on the chubby side and have always been that way, the body balances out this extra estrogen, in quotes, that is supposed to come from the adipose tissues with the one that the reproductive system is producing. And for that reason, because of that stationary level of weight, as it were, such people are able to have normalcy in their reproductive health or in their reproductive life. They have children. You see very fat women having children. This is because their body has normalized the hormones from the excessive adipose tissues with its own normal production, and everything is at a stable state. Now, when a woman who is just on the average level of weight suddenly increases, now take note that this woman already has her own stable metabolic state. Everything is baseline for her as in normal, and then there is a sudden jump in weight increase. It only makes sense for you to understand that the extra weight you have gained also comes with these other hormones that we are talking about. So for a woman who is maybe 60-65 kg suddenly jumping to 80 kg 85 kg or more, you can just think about it. The extra fat cells that you got are coming with their own hormones. This inadvertently brings about some level of hormonal imbalance already. This kind of hormonal imbalance can tip off the reproductive system and then cause a woman to fall into the category of being infertile just because of that increase in weight. A woman who is also stable state, again, let's say 65, 70 kg, and suddenly drops to 40 kg, you find out that that balance that the body had, the level of hormones that the body has been able to maintain as normal will also drastically reduce, still bringing about hormonal imbalance, still causing the woman to suffer some level of infertility. The same thing applies to men. Now, for men who are normal weight and then just have a sudden rise in their body's weight, this weight increase happens within a short time, not a gradual thing that the body can adjust to. Take note, just a sudden rise in weight. By sudden, it can happen over a year or over 2 years. That is sudden enough for the body. Than weight that you just gain over 10 years is different. The body can adjust to that. But when this weight increases over a year, 18 months, 2 years, it is kind of sudden to the body. It's not what the body is used to. It will take some time to adjust to that. Okay, so also for men, when there is a sudden increase or decrease, the hormones are also still affected. Imagine a man having excess estrogens in the body. This can suppress the function of testosterone in the body and still cause the man infertility. It is different from a man who has always been on the chubby side. Yes, you might be asking this question, fat men who have children. Yes, has always been on the chubby side. The body has normalized its hormonal level with what is being produced and the excess from the adipose tissues as the fat cells, and that person has a steady state of the hormones. It is this drastic sudden changes that brings about alteration in the metabolism of the person's system, the reproductive system in this case, and by extension affects the fertility of the person, be it a man or a woman. So weight management is something that is really, really key to maintaining healthy reproductive system. If you are on the chubby side already, you might want to lose some weight, because if you lose some weight, you might be helping your body to balance out its hormones by bringing them back to normal. If you are too skinny, you might want to eat up to add a little more weight so that the body has enough hormones to service the reproductive system. So whatever category you are in now, be it big or small, one thing that helps us in the management of this weight is the person's body mass index, the one we call the BMI. So you might want to ask, if you're asking now which weight is normal, which weight is good, from what I have said, you can see that it's not about the weight per se. Because if you were 70 before and you turned 90, that's a problem. If you were 45 before and you suddenly turned 70, it's a problem, because you see that person that was 70 turning 90, 70 is not the problem. It's the rate at which the weight increased. So if you are 45 and suddenly turn 70, that 70 becomes a problem for you. So what you can use to measure this, or what you can use in coordinating weight management, is the body mass index, which is a measure of the weight divided by the height in square meters. So the weight in kilogram divided by the height in meters squared becomes the BMI. Normal BMI for a person is between 18 and 24 kilogram per meter square. Of course, that's the unit. So if your BMI is falling between 18 and 24, then it's fine. If it is somewhere in the neighborhood of 25, 26, well, you are getting a little bit overweight. That might not be too much of a challenge. But once you hit 30, then there is obesity that can affect a person's fertility. Beyond 35 is more serious obesity. Okay, so between 25 and 30 is overweight, but that might not be too much of a problem for a person who is trying to conceive. But once you hit obesity, and obesity doesn't mean that somebody has morbid weight. No, just measure that BMI. Remember, it works with the height, so that will tell you where you actually stand. BMI that is also lower than 18 is also a challenge for the reproductive system, okay, because it affects the person's metabolism with respect to hormone production, and by extension affecting the person's fertility. We hope this information has been useful. Again, as always, please follow us on our social media: Facebook at Love Foundation, Instagram at Love_Foundation_, YouTube, where you are seeing this video now, at Love_Foundation. Like, follow, share, learn to teach others. Until we see you next time with another episode. Thanks for staying with us. Bye bye.